In other news, more and more Israelis are falling seriously ill with coronavirus, and primarily among the unvaccinated demographics. Hospital staff sharing horror stories from their respective ICUs, many of which have already closed due to the overcrowding. With me to discuss is head of internal medicine at Israel's Sheba Medical Center, Dr. Gadi Segal. Dr. Segal, thank you so much for taking the time to speak with us today. Now, we've heard that the unvaccinated patients are getting the worst end of this disease, but how big of a difference are we really talking about? Can you describe the severity of the symptoms for an unvaccinated patient versus a vaccinated patient from the same demographic?
Yes, we must remember that COVID-19 is, let's say, three-modal disease. It begins like a flu-like illness with a stage of viremia in which the viral particles are being multiplying in the bloodstream and in the tissues. And the patient experiences very harsh flu-like symptoms, a high-grade fever, a myalgia, which is diffuse muscular pain, fatigue, nausea, loss of appetite, and everyone knows the flu-like syndrome. And this is the viral disease. Now, we are dependent upon our immune system in order to evade the transformation, the transition from the viral stage to the inflammatory stage. And I can tell you that as far as I see, this is the main issue, the main difference between vaccinated and non-vaccinated patients. The vaccinated patients are staying within the viral disease and they do not deteriorate, or we should say more correctly, the vast majority of the vaccinated patients do not deteriorate from the viral disease, the flu-like symptoms, to the severe pneumonia, which necessitates a high supply or high demand of oxygen and steroids and so on. So I can differentiate very good between vaccinated and non-vaccinated according to their tendency for deterioration from one phase to the other. By the way, vaccinated patients which have immune deficiency because of other background treatments or diseases behave pretty much like the unvaccinated patients. So currently, with our accumulating experience, we can say that this is indeed the role of the immune system. The intact immune system defends us from deteriorating.
All right, now patients have supposedly been expressing regret practically on their deathbeds oftentimes for not getting vaccinated. Have you heard any of these such regrets? Have you been hearing people speaking like this?
Yes, of course, but you must know that when we meet the unvaccinated patient when he's already ill, it's like water under the bridge. Nothing good will come out of discussing it. And I'm a physician, I'm not a lecturer or a policeman. So it is not my role to discuss the lessons to be learned when the patient is acutely ill. So I do hear that. I most often hear family members regretting for their beloved ones not getting vaccinated for all kinds of reasons. The most common reason is when they say that it was a fake news that caused them not to vaccinate. But I do not elaborate on that. We do not develop this issue to conversation. It is inappropriate to deal with that during the acute disease.
So what do you say to these such patients and their families when they speak this way, if anything?
That currently it doesn't matter, and currently we look only ahead, and we are doing most of our efforts to recover. And when they recover, I do ask them, now after you saw the horrors of COVID-19, please be a good messenger and keep your beloved ones healthy and ask them to get vaccinated. By the way, I tell this to all my patients, both vaccinated and non-vaccinated. I think that the recovered patients are the best sentinels, the best messengers for this message. Get vaccinated soon.
We also know that there are a number of coronavirus treatments, not cures or vaccines, that are in testing at a number of different hospitals around Israel. Have you been involved with any testing of these products, of any of these drugs?
First of all, it must be stated that currently we don't have any effective anti-corona medication, none. This should be clearly stated. We have only measures that help the body to defend itself. We give steroids, which are the only proved remedy for the more advanced stages, but all antiviral medications are only partially and weakly effective. I'm involved in several researches, and also I am the head of the committee that gives the Israeli Ministry of Health advice regarding approval of clinical trials in human beings in anti-corona medications. And I can tell you that we get many requests for clinical trials. Most of them, unfortunately, are non-relevant and cannot be approved on ethical basis.
All right, now you are involved in several committees that we know of with respect to the coronavirus, as you've mentioned. Is Israel going about things the right way then, especially amidst this fourth wave?
It is a difficult answer to give. What do you mean when you say Israel? Do you mean the Israel government, the Israeli people, the Israeli army, the Israeli health system? I think that each and every one of us should do its best. I think that the health system is functioning very good, bravely, for over a year and a half. And I must tell you that it is extremely difficult for us in the internal medicine departments, in the intensive care units, in the emergency rooms, at the geriatric departments. All the staff are very tired and worn out from fighting this disease. And I think that the Israeli healthcare system is working very good. The Israeli government, I am not to judge their activities. I think that they are doing their best. I think that currently, when they keep the market open, they are taking a very big risk. And I think that this risk will be judged by the history. And I think that there must be transparency. The government must tell the people, we are taking a calculated risk. We do not close the country because we believe that the third vaccine will enable us to go through these flames. But as I already said and wrote, this depends on the fact that there is another side of the flames, that indeed we can get out, and no one promises that. So this also should be stated. We are doing a very major risky trial on a nationwide basis, and I do hope that we will succeed.
Dr. Gadi Segal, thank you again so much for taking the time to speak with me today.
You're welcome.